Training College. So you can imagine the numbers that they deal with come every year and for every graduation. And so we actually want you to continue to weigh in on our discussion. Give us your thoughts. What do you also have to say about health workers in this country, especially those who are considered the middle-level health professionals? Our question of the day is there on your screen, and this is what we ask. What is the biggest challenge the healthcare professionals face today? What is the biggest challenge our healthcare professionals face today? At K24 TV on Instagram, Facebook, and Twitter. If you'd like to WhatsApp us, our line is active. You can see it at the bottom of your screen. Okay, over to the feedback that is coming through. Is there any course called Operation Theatre Technology being offered at KMTC? Do we have another text? But okay, in the meantime, Professor Kiptoo, welcome back. You've got a question here and someone asking if you do have that particular course at KMTC.
We don't have a particular course called Operational Theatre Technology.
Yeah.
But we have several courses that are aligned to theatre technology.
Yeah.
But basically those are training clinical officers who are either anesthesiologists, who will really work in the theaters, but it's not referred as operational theater technology.
Right. Okay. Continue to talk to us, and of course, if you've got any question for Professor, we shall be sure to share it with him. Now, Professor Kiptoo, when we talk about healthcare professionals in this country, there is a shortage. You even mentioned that. And, you know, you also have mentioned quite a bit, even on your site, for example, that KMTC graduates are highly sought after outside the country. Perhaps maybe we all know one or two people who went abroad and are actually doing nursing as we speak, and there are success stories because they're doing well. But how does this really solve the issue of our shortage here in the country? If you ask me, it's kind of like brain drain that's you know, happening in the medical industry or fraternity, because people are getting their skills from KMTC and taking them abroad.
I think it's not really brain drain.
Yeah.
If you look just a few years ago, look at Cuba. What are they doing? They have invested a lot in training in medicine, and they're exporting. Yeah. So what's wrong with us exporting? We are giving opportunities. They plow back to this country in terms of economy. So to me, it's not really brain drain. Yeah. It is also a concept whereby there is that understanding of what is happening in other countries. We provide the opportunity. Yeah. So to me, it's not really brain drain. Of course, at the end of the day, if we are not able to provide the opportunities for them to be employed here, should we limit the opportunities for them? No. I say no. If Shiko, you are not here today, who says you cannot go and work in BBC? Yes. Or any other media house. So it's the opportunities that we provide. Right. So to me, we are not really having brain drain, but we are actually exporting, and we get revenue back to this country. Because at the end of the day, if you look at the globally, in terms of income, we are getting more development from people who are in the diaspora. And I think to me that is very key. Yeah. We have enough personnel who should be able to work in this country. The missing link is that we may not be having enough resources to employ all the people that we train. Right. Okay. You know, now that we are finding ourselves battling, you know, as a global village, a disease like coronavirus, you know, just not long ago, or even currently, there are still cases of Ebola and just other diseases that we are dealing with, Professor. You actually talk about your curriculum more or less like evolving to probably, you know, create that preparedness for emerging and reimagining diseases that are popping up. So tell us about that. How are you able to, you know, get your trainees prepared to even go out into the market to face
these ongoing situations. Even now, you know, one of the challenges is, are these middle-level health professionals actually equipped to deal with coronavirus? So it seems like they probably will have to do a refresher course on how are we going to deal with all these cases, you know?
The people we train are professionally prepared to deal with the situations as they arise.
Yeah.
One is that coronavirus is one of the current emerging infectious or viruses that we know, which is an RNA virus. Yeah. They'll keep on coming, but what is important is that you have the basics.
Right.
And our curriculums are reviewed between 3 to 5 years. And that takes care of the new information that is being generated. And if you look at coronavirus, the prevention mechanisms that are available are simple hygiene. Right. Of course, it is, as I mentioned earlier, it's an RNA virus which is subject to weather conditions. Yeah. And they cannot survive for long outside. So if you look at preparedness that we have in this country, is that we just need to have the isolation facilities. Right. And I'm happy that the government has done that. Right. Both the national government and the county governments. And we have personnel who have been trained to use the equipment, which we refer as personal protective equipment. Right. Really, to be able to use the N95 masks, be able to wear the relevant equipment that you need. So you don't really need to have a retraining. Right. It's just an application. That is just required. Okay. And these people have been taken through the process. Yeah, I think that probably gives some sense of calm. Because some of those are some of the questions that have been popping up, that yes, okay, we perhaps do have specialists when it comes to dealing with such epidemics, but then what happens to the mass bulk of health professionals who probably would not be prepared to deal with that? And so when you say that, okay, if you do have the basics, it is doable, then I think if that restores some sense of confidence, by the way, in our health facilities. You know, when we talk also about welfare in this country, I'm wondering, because pretty much if you join any university, any institution, you will find people, you know, especially the alumni body, you know, coming together, going beyond their school years, being able to handle situations, the market together as one force. Does KMTC actually offer such support services for their students, their graduates who've left, and you know, they can be able to tackle things together? For example, you know, the issues that they are facing, the pay grade that they have to, you know, deal with at health facilities. Are those conversations actually there? The conversations are there. If you look at the health workforce in this country, if you look at the nursing, we have the Nursing Association, we have the Clinical Officers Associations, and those are the ones that now will handle the welfare. So as KMTC, what we have is the alumni fraternity, where they are able to interact and ensure that there is that unity. If they need to support the institution, they can support. But when it comes to welfare, it's now being handled at a different level. Of course, there is Association of Nurses, I've already mentioned, clinical officers, and so on and so forth. So that now ensures that there are issues to do with pay. There are people will champion at that level, not at KMTC level. How does that make you feel, though, Professor, that perhaps if we talk about 85% of the local health sector having passed through KMTC, those were your students, you know? How does that actually make you feel when you see them on TV saying that we have not been paid for 4 months, 5 months, they are having issues with their county government? You know, what runs through your mind when you see perhaps those were my students somewhere in some part of the country? To be honest with you, I really feel for them. Because any person who has given a service must be paid back. Because you can imagine if you stay for 4 months without pay, you have to incur transport, you have food, you have a family to bring up. So all that must be remunerated well. So it's the onus upon the employer to ensure that they pay our graduates. Because they have gone through staff training, if you want to call it.
Yeah.
They are delivering a service. They are serving our people.
Yeah.
They must be paid.
There is quite a number of, you know, these health professionals who obviously they cannot be absorbed by the private sector. But there's that push and that pull of saying, you know what, if county government is not going to help us, then you've got an influx of people trying to rush to the private sector to work. Now, for all these private hospitals, Professor, you know, your thoughts on that?
When you look at the opportunities, if they work in the private sector, and by the way, we have the majority in the private sector, and these are who attends the private facilities. Yeah. It's me and you. It is Kenyans. So we have not lost anything as a training institution. We have trained people who are attending to our fellow citizens. Yeah. So if the opportunity is in the private sector, let it be. In the public sector, we allow those to provide the opportunities. All right.
I understand we've got a caller on the line. Do we have Bernard Director? Okay. Anthony from Malaba is with us this morning. Hi, Anthony.
I'm fine.
Yes, go ahead. You have a question, a comment for Professor?
I'm listening to the discussion that is on TV.
Yes.
About, he's being asked about the coronavirus and how prepared the country is. We have been told that they have prepared rooms in Nairobi where when people become sick, they'll take them in those rooms. Yes. They only have to prepare in Nairobi because there is an airport there. Yeah. But remember, there is also an airport in Mombasa. Do we have the same preparation in Mombasa? Yeah. Here, Malaba is a porter. Do we have any preparation here in Malaba also? Washia is also a porter. Is there any preparation? Do we have those rooms that have been separated? Yeah. In case a patient happens to be found here, how long will it take for him to be taken to Nairobi? And how prepared are they? Those people that will be taking the patient to Nairobi? Yeah.
All right. Thank you so much for that, Anthony from Malaba. Okay. Professor, I hope you've had that. I know you may not be able to answer in depth because he's literally asking, you know, about the preparedness at health facilities. But let's take a look at WhatsApp text messages very quickly. Hi, my name is Lillian, a community health volunteer for 9 years, and I would love to be trained, but I am a Form 3 dropout. How do I go about this? Very good question from Lillian. Okay. Let's take a look at another text message. We've got, hello, I'm Chepngetich from KMTC Thika Campus. Congratulations to our CEO, Mr. Kiptoo, and the KMTC board members at large for everything they are undertaking to enable us to undertake and pursue our courses. Have a good morning. Well, there you go. Thank you. That's a great message coming in from the rest of you. I am currently in KMTC, and I can rate their standards as 10 out of 10 in terms of quality and service delivery. If you're not serious with your studies, then the speed that KMTC moves with will definitely overwhelm you. Okay. All right, Sasa, thank you so much for those text messages. All right, so there you have it. Someone completely agreeing with you that if you do not take your studies seriously, what you expect you shall repeat, hence the longer time you will be spending on campus. But lots of support, and of course we've got another text message for someone saying congratulations as well to the entire KMTC board. Do you want to say asante sana to them?
Asante sana.
Lillian has a good question for you, Professor. Form 3 dropout. Lots of people who didn't manage to actually go through and complete their high school and their learning. What in such a situation should someone do?
I'll encourage Lillian. Yeah. There's to go back and study. There's opportunities, adult learning. Yeah. Of course, there's no shortcut.
Unfortunately.
Unfortunately.
So she has to get that certificate.
Form 4 certificate to proceed.
All right. So many questions are coming in, Professor, and mostly those that are coming in are really about admission. So it seems like people need more information on what KMTC requires for the admission process to go through. And like I had said earlier on, there are so many people in that transition phase of their lives trying to make a career decision. What can you say to someone who is considering nursing as a profession, for example, because that bulk of the text message is actually coming in? And of course, for those who even want to be clinical technicians, for example, what can you advise them?
What I can advise them is that there are several programs. We should not just look at nursing.
Yeah.
If you look at the health sector, we have several cadres. We need somebody who will be able to take records,
yes.
And that's why we have a training in health records and information technology. We have clinical medicine. We have other courses in medical engineering, because we need somebody who will be able to service our equipment that we use in the health facilities. We need somebody who will be able to carry out the diagnosis using radiology.
Yeah.
So we have imaging sciences. We need somebody who will be able to dispense the medicine that have been prescribed by the doctor.
Right.
So we train pharmacists. So I think the notion that it's only nursing should not arise. The other cadres that we can train. So I'll urge Kenyans that there are so many opportunities. There's also optometry, and you are looking at it's a course that is very important. You think of dental technology. You think of even nutrition, dietetics, especially when we are dealing with life diseases currently. So there's a lot of need to have nutritionists in our setups.
Yeah.
So I want to encourage them that they can visit any campus that is closer to them, and they'll be given advice by our officers in those campuses. And they can log into our website and get more details.
Okay.
They can also call. And to emphasize that admission is online, it is free. You only pay 2,000 for the application fee, and you pay through M-Pesa. Nobody should be cheated to pay any more money.
Right, and you do see that happening. Yes.
There may be a few cases, probably, for those people who may not be aware, but we have actually ensured that the information is available.
Right.
We even, the campuses that are available, do promotions in terms of our courses that we have. So it's just a matter of time that if somebody doesn't have the information, I'll urge them to call to our campuses near them.
You know, this is such a timely discussion. Just yesterday, I don't know if you watched the news, there are a number of facilities, or should I say, institutions that have been barred from actually teaching medicine because the quality, the standards are way below what has been expected. And so you can see some of the situations that are happening and leaving these students in problems. Because you can imagine you applied to one of those campuses, you're probably in your second year, and then you find out that the school has either been shut down or a particular program has been struck off. Your thoughts on that, Professor Kiptoo?
What I'll urge institutions is to ensure that we maintain the standards that are required.
Right.
And for us as KMTC, we ensure that those standards are met. First, is that you must ensure that you have the right infrastructure to be able to offer a certain course. For instance, you cannot offer dental technology if you don't have the equipment and you don't have the personnel.
Right.
So you must meet the minimum criteria to be able to offer those courses.
Yeah.
If you're not able, then it's unfortunate that you'll be wasting a lot of Kenyans with the potential that they need. But I'm happy to note that as KMTC, we are on top of things. Yeah.
All right, more text messages coming in. Let's take a look at those as we begin to wind up. Hi, Shiko. Ask Professor what the institution intends to do on the issue of low enrollment of medical laboratory sciences due to students not meeting the entry requirements, which has left most campuses with no students. How true or false is that, Professor? Low attendance. Okay, as you answer that, let's take a look at another lengthy text message that has come out, or rather come in. Hello, I'm a healthcare worker in a very high volume facility. The human resource shortage is the biggest challenge. Hence, the few of us get overwhelmed by the huge number of patients we have to attend to. A person goes on to say, this causes unnecessary loss of lives that would otherwise have been saved. Another issue is that we are not motivated. For example, since I got employed back in 2012, I have never been promoted to the next job group. Still at the entry-level job group despite upgrading from diploma to degree, and currently pursuing masters. Last text message, hello K24, I'm happy you have brought a very important personnel in studio to help us understand more about KMTC. My question, can a clinical officer work outside Kenya? Number 2, does KMTC offer sponsorship to needy students? All right, Sasa. So a number of points that have come through. Do you want to start off with whether or not you sponsor students?
I can start with that.
Okay.
One is that there are a lot of opportunities for sponsorship. One, there is the Higher Education Loans Board, which provide resources for students, and our students qualify for those.
Yeah.
So it's just an issue of applying for those sponsorship. We also have specific programs where we are sponsoring through with partners. The one I'll want to mention is through the Beyond Zero, where we are sponsoring 100%. There are few, but specifically for nurses, to take care of mother-to-child health issues in marginalized communities. We have also bursaries through the members of parliament. We also have the women reps who also provide bursaries. So those are the opportunities that our students will be able to get fees being paid for them. The other issue in terms of can a clinical officer work outside this country? Yes, they can.
Okay. We had the question about low enrollment in specific campuses, especially when it comes to lab work, that someone had actually asked about earlier on. And they say that your requirements are rather high because people don't seem to be meeting these requirements. Your take on that?
I think what is very important is that we must maintain the standards. So if you don't qualify to do a course, we'll be risking this. We are dealing with human life. So if you do, especially medical laboratory sciences, these are the people who do the diagnosis. So if they give the wrong diagnosis, can you imagine what happens? The doctor will prescribe the wrong medication, which will cost a lot of money, waste time. And for us, we need to ensure that we have the right people with the qualifications. Two, we need to ensure that technology changes as we go along. If you look at the medical laboratory sciences of the last 20 years, it's not the current technology we are currently using. We no longer do a lot of blood smear for malaria tests, for instance. It can be done on the spot by even a medical doctor or a clinician or a nurse. So there's that shift in terms of technology, and we must ensure that we are either overtaken by technology or we go with it.
Okay. We have also someone who talks about how they upgraded from a diploma to a degree. Lack of motivation in the health sector, Professor. This is what a lot of them are actually dealing with from day to day. Your take on that, and let me just combine it with what I was hoping to ask you about community health workers. When we talk about community health workers, what are we talking about? Primary health care, and of course, in order to achieve UHC. What can the county governments do, especially for those in the public sector, to just motivate people to take up more roles like community health work?
I think it's very important that the county governments ensures that the people working at level 1, level 2, level 3 are actually given the dues that they deserve. One, these are the contact people that will be able to ensure that we achieve UHC. And when you look at that person who has not been promoted having done masters, I want to encourage her or him that it is good that she has upgraded her training. It's just a matter of time. Again, you need to look at the progression in terms of career. There are stipulations. You may be having a master's, but you meet the criteria that is required for you to move from level 1 to level 2. There in terms of establishments. There are vacancies. So it's not just an issue that you have the qualification, but you need to look also at what are the resources required to take those people to the next level. All
right. Well, we want to thank you for your time, Professor. As we say, Kwaheri. I understand we've got one last text message or question for you that I've been told we cannot leave behind. Hello, I would like to confirm if KMTC offers mortician programs, and if any, how long does it take? I did my KCSE 2018 and obtained a mean grade of C plain. Ronald Ruto asks that question.
If you look at that, is that we do offer, but not specifically as morticians, because it's a career that we develop in the next level.
Okay.
So we'll give the basics, and then now you move to the specifics that are required. Yes.
All right, Sasa. How can people find out more information about KMTC, Professor, in case they actually do want to enroll for whatever course that may be offered at KMTC?
I'll ask them to visit our website, www.kmtc.ac.ke, and they'll get all the information they require.
All right, Sasa, and there you have had it for yourself. By the way, there's not just one course, which is nursing. So many questions coming in about nursing. There's quite a number that you actually can choose from. I believe they have probably about over 17 courses being offered at KMTC. And so we thank the CEO of KMTC, Professor Michael Kiptoo. And if you would like, of course, more information, go to their website. That brings us to the